Hello everyone, this is Alraies from SCAI 2022. With me, Dr. Ziyad Hijazi. He is chairman of cardiology at Sidra Medicine, as well as the chief medical officer and affiliated with Weill Cornell. Dr. Hijazi, always pleasure to see you.
Pleasure is mine. Thank you, Shadi.
Yeah.
Thank you.
You are a pioneer in the field, and tomorrow you are giving a major lecture at SCAI 2022.
Yes.
Please tell us about your vision and how do you see our field going forward?
Great. Thank you so much for having me. Being a member of SCAI for over 25 years. I was also the president of this society in 2008. So the society means a lot to me. So tomorrow I'm going to give the Mullins lecture. Most of you, I hope all of you know Dr. Chuck Mullins. He is one of the pioneers and founders of interventional pediatric cardiology, and it is my honor tomorrow to give his lecture, the named lecture. In the lecture, I will focus primarily on innovations in congenital interventional cardiology. And if you notice, I did not call it pediatric cardiology. I called it congenital because, as most of you know now that more than 50% of our patients are adults. So to call it pediatric is really now not the right thing. So I will focus on the innovations of ASD because I take ASD device closure as the cornerstone of interventional cardiology in general, because back in the 70s, when Dr. Terry King started doing ASD closure, there was really no interventional cardiology, period. Adult or pediatrics, right? And the innovation in that field, the transcatheter closure of ASD, really was the impetus for everything else that we are doing nowadays. The fact that an interventional cardiologist was able to close an ASD without cracking the chest really paved the way to what we do nowadays, from stenting to TAVI to mitral valve to all of this. So the field, has moved significantly, and if you look back in the 70s, the devices were crude, bulky, and the success rate was low, and you had to screen many patients to find one suitable patient. It had to be a perfect circular defect in the middle of the septum. Now, of course, even sinus venosus ASDs now, we can manage them in the cath lab. Obviously the devices themselves, they improved significantly, and although now we have very safe devices, still there are potential complications from ASD device closure. And of course, the complication that we fear the most is cardiac erosions. This is very serious. Fortunately, it's very rare. Because of this, we still need to innovate in this area and to improve what we have. So we are moving, I am hopeful, towards what we call bioresorbable technology, so that you can close the defect, and within, let's say, a year to no more than 2 years, if you look at the chest of the patient and by x-ray, or you look intracardiac, you will not see any evidence that you touched at all. So we're still, not very far, but I would say a few years from this technology. And this is just for ASD. And of course, this holds true for ventricular septal defect, patent ductus arteriosus, as well as, of course, the current valve technology. Now, we put valves in patients without open heart surgery, but we leave, a big bulky device there, and it does not allow for growth of the child, or in some cases for valve-in-valve, unless if you put a large valve to start with. So if you develop something bioresorbable or stem cells, this will allow us to repeat intervention in these patients. So I think the field is exciting going forward, and I am so privileged to be part of this field.
Dr. Hijazi, one last comment about imaging, the role of imaging during these procedures or screening for these procedures.
Certainly, Shadi, imaging is integral part of, in this case, for example, ASD, because one major part of the failure reasons for these patients was imaging, because back in the 70s, everything was done under fluoroscopic guidance. Imagine closing an ASD, large ASD, under only fluoro guidance, no echoes. Even to transthoracic. And I must give credit to my mentors at Yale In the late 80s, early 90s, 1991, when I was a fellow at Yale, Charlie Kleiman, God bless his soul, he passed away. He was the chief of the division and was a well-known echocardiographer, with the cath lab director then, Bill Hillenbrand, who's my mentor in interventional cardiology. They started using imaging to guide device closure, and just overnight the success rate has improved significantly. So nowadays, of course, we are much more sophisticated and everything, but the imaging has significant role in improving our results. And I say to patients, don't cut corners. Use every available technology to you to enhance your success rates.
Dr. Hijazi, thank you so much for giving us that intel and insight about the lecture. And really, I'm very privileged to hear it firsthand. Thank you for your time. And please watch these videos and others on SCAI-TV. This is Alraies from Atlanta. Thank you.
Thank you so much. Thank you. Thanks.